Welcome to the Joint Legislative Audit and Review Committee's Committee to Hear State Auditor's Office Performance Audits. Today is Wednesday, July 15th, 2026. We are in Senate Hearing Room number 4 and also online. I want to thank the committee members who are joining us from across Washington State and here in the Senate Hearing Room. We are going to hear the SAO staff presentation of their recent report evaluating success of the Restoring Quality Home Care Initiative, I-1163. I am Representative Jerry Paulette, Chair of JLARC. To my left is Secretary of JLARC, Representative Ed Orcutt, and I may have to leave a little bit early, in which case Representative Orcutt will chair the remainder of the meeting. And to my right is Legislative Auditor Eric Thomas. And Eric, you have an announcement to be made. And while you're taking a look at that, you're right there. Okay.
Thank you, Representative. By July 1st of each year, JLARC must report the status of SAO's recommendations to the legislature. As a reminder, JLARC does not report on SAO's recommendations to state or local governments. JLARC staff review the status of SAO's recommendations after each session and have that report available on our website.
Okay. And our website is part of the legislature's website, easy to find at leg.wa.gov. So the performance audit we are hearing today was conducted solely and independently by the State Auditor's Office under the authority of legislation approved by the voters as Initiative 900. The legislature holds public hearings within 90 days of each audit's release, and the committee takes public testimony, but the committee does not vote or take or endorse the audits. We hold the public hearings on them. The state auditor is elected directly by the people of the state of Washington, and the office operates independently of the legislature and independently of the Joint Legislative Audit and Review Committee. JLARC members attending virtually, please let me know during the presentation if you have a question using the raise hand feature on Zoom, and Auditor Thomas has it up on the screen next to me, and he'll let me know. After the SAO's presentation, agency staff will provide comments on the audit reports, and JLARC members will have an opportunity to ask them questions as well. Then we will take public testimony after the presentation. You can register in person or online to give testimony through the legislature's website, and we do encourage testimony. And you can also submit written testimony, and I'll go over that at the end of the session. Provide written testimony on today's agenda and topics. Submit comments to JLARC at leg.wa.gov. That's submit comments to JLARC at leg.wa.gov or by mail to P.O. Box 40910, Olympia, Washington, 98504. Any written testimony will be distributed to all the JLARC members. With that, I'd like to ask the State Auditor's Office staff to come on up and introduce yourselves, and you'll have control of your presentation. And thank you for being here in person with us.
All right, thank you, Mr. Chairman and members of the committee. My name is Justin Stowe, and I'm the Assistant Director of Performance Audit at the Washington State Auditor's Office. I'm joined today by my colleagues Corey Crowley-Hall and Michelle Fellows, and we will be presenting to you Our audit report on evaluating success of the Restoring Quality Home Care Initiative, otherwise known as I-1163. Before I turn over the presentation, I do want to take a moment to pause and thank leadership and staff from both the Department of Health and the Department for Social and Health Services for their cooperation and assistance in this audit. It is very much appreciated. And with that, I will turn it over to Corey to begin the presentation.
Thank you, Justin. I'm Corey Crowley Hall. Michelle and I conducted the work on this audit. Home care aides support people who need extended care due to age or disability in many different settings. They help people perform activities of daily living, such as dressing, bathing, and transferring in and out of a wheelchair or bed. While home care aides often provide care in clients' homes, they also work in adult family homes and assisted living facilities. Initiative 1163 was passed by Washington voters in 2011 to protect vulnerable populations. I-1163 established a home care aide certification. To be certified, prospective aides would need to complete 75 hours of training, pass a hands-on skills test, and a written knowledge test. It mandated FBI background checks for all long-term care workers, which includes home care aides, nursing assistants, and nurses. And it created a registry of substantiated findings of abuse and neglect for home care aides. Training, testing, and certifying a home care aide typically involves multiple organizations. The Department of Health accepts applications, oversees testing, and issues certifications. The Department of Social and Health Services designs training curricula, approves trainers, and processes the FBI background checks. 400 training programs from around the state provide the approved 75 training hours. The state's testing vendor, Prometric, tests prospective home care aides. And employers of home care aides are also involved in the process from start to finish. At a high level, the audit found some 1163 requirements make people safer, but safety depends on access to care, and Washington has a long-term care workforce shortage. Some requirements created a complicated system without adding value and safety for clients. And streamlining the complex system can speed up certification. We conducted this audit because 1163 requires our office to audit the state's long-term in-home care program every 2 years. This is our 9th audit in the series. Past audits have identified persistent challenges with the certification. This has led to questions about whether 1163 is achieving its intended outcomes and what improvements to the process might benefit aides and clients. This audit sought to identify if the home care aide certification has made vulnerable clients safer, if the requirements affected people's ability to obtain care, and what changes would improve the process. Let's start with the first question about safety. The audit aimed to measure the extent to which 1163 achieved its broad policy goal of increased safety for vulnerable populations. However, the state lacked data from before 2011 for us to make valid comparisons. Some pieces inherently make people safer, even in the absence of outcome data. For example, the registry creates greater transparency around the history of a home care aide that can be checked before they are hired. Additionally, we relied on the testimony of experienced professionals and experts in the field, as well as published academic reports. We learned the following. Background checks for these type of workers are widely accepted as an important safety regulation, and the 75-hour training was seen as helpful and not a barrier to becoming a home care aide. We also sought to identify if the requirements affected people's ability to obtain care. When aides are unavailable, clients either go without care or receive care in more costly settings such as nursing homes. There is a national shortage of long-term care workers. We compared Washington to other states using data on the number of home care aides, nursing assistants, and similar positions versus the number of people who identified themselves as having a disability. Although Washington has a shortage of workers, Washington's workforce is closer to meeting the demand than in most states. We observed that New York had the most workers per disabled person, while Alabama had the fewest. Washington ranked 12th, outperforming the median state of Colorado and our neighboring states. We also looked for whether more extensive requirements for similar workers to home care aides systematically affect the share of a state's workforce serving those clients while controlling for wages and demand for workers. Our simple regression model showed no such effect, either positive or negative. States with more requirements to enter this field of work perform no differently in recruiting and retaining workers than states with fewer requirements. When clients qualify for Medicaid long-term services and supports, DSHS case managers assess clients' care needs and authorize the number of hours of care that Medicaid will pay for. We analyzed Medicaid data comparing the records for these authorized hours with billed hours. DSHS had not established a standard for the percentage of hours that clients should use before it becomes a concern, so our analysis set a threshold of 75% or less of hours used. We found that about 1/3 of Medicaid clients use 75% or less of their authorized hours, with some using considerably less. There are many reasons clients might not use all their authorized hours, including client choice. However, DSHS case managers are instructed to adjust authorized hours to reflect clients' changing needs. Large gaps between authorized and billed hours can suggest situations where clients do not have access to caregivers. We then built a statistical model to determine whether some groups are less likely to use all long-term care hours designated by DSHS. Some groups had more difficulty obtaining needed care. This was especially true for children without an individual provider. Individual providers are often family members or friends of the clients that they serve. Around half of children without an individual provider use 3/4 or less of their authorized hours. Our analysis also noted racial disparities. Native American clients were the least likely to use their approved care hours, while Asian clients were more likely. Geographic location was also a factor. This map shows in light green counties where Medicaid clients have larger gaps between authorized and billed hours compared to the dark green counties where Medicaid clients are using higher percentages of their authorized hours. Causes for less use of authorized hours in some parts of the state may include an older population that is more likely to need care with fewer young people to provide it, and lack of access to regional test sites for workers to become certified. We've discussed our findings around safety and availability of workers. Our final objective was focused on the challenges getting certified and the changes that may improve the process. I'll turn it over to Michelle to discuss this last piece and our recommendations.
Good afternoon. I'm Michelle Fellows. Let's start with an overview of the certification process. For most prospective aides, the process begins when they're hired. Once they're hired, their employer is required to run background checks, and the aide is required to complete an application for certification with the Department of Health. The applicant then needs to complete 75 hours of training, pass a written knowledge test, and pass a hands-on skills test. DOH then verifies the results of the FBI background check that employers ran when they hired the applicant, and make sure the applicant has met all of the requirements before issuing the certification. Some of this process is working well. However, we're going to focus on its challenges and what can be done about them. The first problem we identified is that most home care aide applicants never complete the process. The blue line on this chart shows the number of applications received each year. You can see it's been increasing since 2022. And the orange line shows the number of people certified each year. The gap between these two lines represents the number of people who applied but were never certified. Of the roughly 13,000 applicants in fiscal year 2024, only 5,000 were certified. This means almost 8,000 people had some interest in doing this work, but did not complete the certification requirements. I'll note that for fiscal year 2025, more people could be certified than what the orange line shows here because our data set ended in January 2026. Oops. Applicants quit the certification process for different reasons. It's an occupation with high turnover and relatively low wages, but also this audit and others we've done have found some applicants were also never certified due to the challenges they faced during the certification process. The second problem is the process can take a long time, longer than what's legally allowed. According to state law, applicants are required to be certified within 200 days of hire. In fiscal year 2025, only about 1/3 of applicants were. A temporary deadline extension that year gave applicants 365 days to complete the certification, yet most wouldn't have met that timeline either, as applicants were certified an average of 463 days after their hire date. The certification process has burdened home care aides and their employers. Some aides have quit due to challenges navigating the system. Other aides have lost income. This is because some employers recognize certification with a pay raise. So when the certifications are delayed, so are these aides' raises. Employers are required to fire aides who are not certified in time. Some describe needing to fire good staff when their certification took too long, and facilities can be cited for failing to have caregivers credentialed by statutory deadlines. We also heard that the delays, combined with the ability to reset hire dates, has meant that aides can repeatedly change employers to avoid hitting the certification deadline. As such, some aides could conceivably work for years without ever being certified, essentially providing unlicensed care. What can be done to improve the process? Well, the first challenge we'll highlight is that the Department of Health reviews applications from people who never complete training or pass their tests. DOH requires aides to apply shortly after they're hired and then begins processing applications upon receipt. However, around 8,000 applicants in fiscal year 2024 never met the certification requirements. Time spent processing their applications was ultimately wasted time. As such, the agency could begin only accepting applications from people who have already finished training and passed their tests. At least 2 other states, New York and Arizona, already do this. The change could significantly reduce staff workloads. One reason certification takes so long is the delay between training and testing. Of the applicants who took their tests, less than 1/3 did so within 60 days of completing training. A larger percentage waited at least 4 months to take a test. When a lot of time passes between when applicants learn new material and when they're tested on it, they're less likely to pass their tests. Interviewees said Prometric's policies were a main cause of delay. For example, Prometric cancels scheduled exams if fewer than 5 people register. Prometric also has a limited number of testing sites across the state, which impedes access to testing, especially in some rural areas. Although Prometric's policies have been a persistent challenge, DOH has not had enough leverage over Prometric to impose the conditions that would address these kinds of issues. Meanwhile, other testing companies have not bid on the contract. DOH is already implementing an improvement that eliminates the delay between training and testing by having the training programs administer the skills and knowledge tests. As of March of this year, around 20% of the state's training programs were already doing this. Applicants in these programs can take the tests on the last day of their training instead of scheduling separate tests and then traveling to a Prometric test site to take them. DOH has found applicants get certified more quickly this way, and a larger percentage are passing their tests. Another challenge is that over time, DOH has needed more time to issue certifications. As shown in this chart, fewer and fewer applicants have been certified within 30 days of passing their tests. Back in 2019, 95% of applicants were certified within 30 days, but by fiscal year 2025, the percentage had fallen to 21%. Program managers at DOH provided a few reasons for the worsening delay. One was challenges around transitioning to a new licensing system in 2024, and another was the Department of Health's redundant verification of FBI background checks. For context, employers for all types of long-term care workers, including nurses and nursing assistants, are required to run an FBI background check at the time of hire. However, only for home care aides, DOH must verify the results before making a decision on an application. DOH has devoted the equivalent of 3 full-time employees to this task, but it's not provided much value in terms of safety. It's also redundant because DSHS and DOH have other ways to ensure employers are running the checks. To help streamline certification, state law could be amended to eliminate DOH's redundant FBI background check verification. To be clear, home care aides would still receive an FBI background check at the time of hire. In our audit report, we made a series of recommendations to the legislature and the Department of Health to begin implementing the improvements we have discussed, as well as other changes that can improve the program. This concludes our presentation. We're available for questions.
Thank you. Sorry. We've got a big lump in the floor here that I've got to get over every time I move the chair up. Don't tell me it's hump day. We have heard a couple of audits here about the testing program problems, and it sounds as if we have not made significant progress there. Did you look at the contract requirements and bid, qualifications for the testing program as to whether or not they have, incentives and penalties for not offering adequate levels of access to testing? And I know that we didn't talk about just now, but there are also barriers on language testing. I'd like to ask you to, for use other languages. Yeah.
Thank you, Representative Polat. We did look at the contract. We saw that there were performance measures that DOH is requiring of Prometric to send to them, but there were not performance standards set in the contract.
So there's no financial
Correct.
relationship in terms of the performance measure? Okay.
Correct. We also kind of looked broadly at the idea of what that contract is able to do for the state, and it seemed that the pathway of moving towards more integration of testing into training so that the department is not as dependent on that contract on being able to have a for-profit company serve people all over the state across rural areas that are long distances from the major cities of the state that have those test sites. So we focused on that reform of the potential to move away from the Prometric contract.
Thank you. And what about the language barrier in the testing?
We've looked at the language barrier in our past audits. We didn't explicitly examine that in this particular audit. I would need to get back to you with any specific information about that, but we were not focused on that question in this audit particularly.
Do either of my colleagues have other questions before I ask another one?
Please proceed.
Okay. Thank you, Mr. Secretary. Mr. Secretary, may I ask a question? We've heard quite a bit about the fact that many people in the home health care provider workforce are immigrants. And obviously, there are thousands of people being rounded up and deported every week. Is there any indication of how that plays into this program and the shortage of people eligible, and whether people are willing to undergo go through the training and background check process?
Thank you, Representative.
They're documented to work here. Yeah.
Thank you, Representative Paulette. We did not do any analysis of the immigration status of people who are working in this field. At the abstract, it certainly seems like a reasonable concern. I'm not aware of direct data on that matter, and we didn't look into it.
Thank you. And so the recommendations here, if we could bring up the slide again for the recommendations. I just want to be very clear about there'd still be a of FBI background check at hiring, and it's just for, I'm not quite sure I understand. DOH is verifying at the time of application, or when are they doing their verification? That's redundant.
That verification occurs at the very end of the process when DOH issues the certification. They're double checking that the person passed the background check in order to issue the certification. What we found was that there's a different requirement to ensure that when you hire somebody, way back at the start of the process, potentially before they've even submitted their DOH application, they need to undergo that background check, and then the Department of Social and Health Services and the Department of Health both have processes in place where they follow up with the employers to ensure that that background check was done. So it's a requirement that only applies to the certification, and there is no analogous requirement for nursing assistants, for nurses, or any other similar profession.
Thank you. And that requires a legislative statutory change? Correct. Okay. Thank you very much. I'm not seeing any other questions. When the legislative auditor and JLARC adopt reports, we send a letter to the relevant committees of the legislature with the summary and bring it to their attention. Just want to double check that SAO is doing the same thing for an audit like this, which obviously has impact across several committees.
Thank you, Mr. Chairman, for the question. That's a little bit outside of my purview, but I believe that our Director of Legislative Affairs, Scott Nelson, who I'm sure you know, is actually in very close contact with relevant members and committees and making sure that they're notified of our work. I will double check that to be sure, Mr. Chair.
There's a report that has several committees with jurisdiction that are very interested in it. So just want to give a little reminder. I'll mention it to Scott as well then.
Thank you, sir.
Okay. Not seeing any other comments, let's move to the response or comments from Department of Health and DSHS. Welcome back.
Thank you. Good afternoon, Chair Paulette, members of the committee. My name is Shauna Fox, and I'm the Assistant Secretary for Health Systems and Quality Assurance at DOH.
And I am Tracy Drake, the Executive Director for the Home Care Aid Program at the Department of Health. So I have some responding comments. I just want to thank you for the time to share the department's perspective on the audit. We appreciate the opportunity to learn from the results of this audit and are pleased that the audit recognized the extensive work that the Department of Health has undertaken to improve the credentialing and testing processes for caregivers. Over the past 3 years, the Home Care Aid Program has made many meaningful improvements to the credentialing and testing processes. We've changed the exam scheduling process to allow caregivers to schedule their exams themselves while still in the training program. Through a temporary financial investment by the legislature, we were able to triple our home care aid credentialing staff to get through our backlog of applications. We have updated our rules to reduce barriers and improve the credentialing process. We have developed criteria to determine how many test sites are needed and where they should be located, and we determined the cost to establish and supply additional test sites. But the greatest improvements have occurred through incorporating testing into the DSHS-approved home care aid training programs. In gross second substitute, Senate Bill 5278 required that the Department of Health and the Department of Social and Health Services work together to develop and implement a plan to integrate testing into training programs. Together, we have successfully moved exams into over 110 training programs across the state. For those students testing within their training programs, they are experiencing higher pass rates, shorter wait times for exams, and faster credentialing processes. This legislation has resulted in vast improvements for caregivers and in turn for the vulnerable populations in Washington. The Department of Health agrees with the SAO recommendation to continue to integrate testing into training programs. The department currently has enough non-union training programs providing exams to allow all non-union caregivers to test within a training program, and they don't have to attempt to schedule exams with Prometric. The Department of Health continues to work with the SEIU 775 Training Partnership to support them also in implementing testing into their 119 training programs across the state. The training partnership is working to obtain funding to implement this effort and has not yet begun doing testing within training programs. The department appreciates the SAO recognition of challenges to the home care aid credentialing process. With current requirements, thousands of caregivers apply for their home care aid credential and later abandon the process without completing training and testing. As a result, staff must spend hours trying to contact applicants to determine if they want to continue with their certification process. The SAO recommends allowing caregivers to complete training and testing before applying for their certification. Once testing is fully integrated into training programs, this will greatly benefit caregivers. This process would allow caregivers more control over their timeline and to be less reliant on the department to complete their credentialing requirements. This would also lessen the time credentialing staff spends credentialing the caregivers and therefore likely to reduce future application fees. The department also agrees with the SAO recommendation to eliminate the redundant FBI background checks. These background checks are required by the employer at the time of hire and also processed by DSHS. DOH also requiring confirmation of those background checks is redundant and requires additional staff time that is not providing any added benefit. The department remains committed to continuing the path of working with DSHS and stakeholders to identify other opportunities to reduce existing barriers for credentialing for home care aides. We're excited to say that we have been receiving positive feedback from stakeholders that the improvements we have made are making a difference for caregivers and their clients. We anticipate that with these SAO recommendations implemented, the home care aide credentialing system would be streamlined further, increasing the number of caregivers in Washington and in greatly improving the lives of Washington's aging and vulnerable populations. Thank you.
Thank you. And does Department of Health have anything in addition to DSHS, or is that joint?
We're both from the Department of Health.
I'm sorry. Okay. Do we have anyone from DSHS on? Yes, we do.
Yes.
Okay. I'm sorry about that.
It's okay. My video isn't showing, but Christine Morris. I'm the office chief at DSHS for training, communications, and workforce development. So I want to thank you.
Christine, give us just a moment to see if it's anything on our end.
Okay.
Where staff is saying it's not on our end.
Let me see if I can check my video.
We hear you perfectly well, clearly, but.
Oh, darn. Yeah, it looks like it should be working. It might be my camera just decided to give it up today.
No, they do that.
I apologize. Yeah, I know. We always have gremlins in our tech systems, don't we? All right. Well, I'm sorry.
Why don't you feel free to just proceed. Yeah.
Okay. All right. Well, thank you, Chair Pollitt, for allowing us to have this conversation too. And I really want to thank the SAO auditors because this was a really thorough audit, and it was really a pleasure to be a participant in it. They interviewed so many different people and got so much feedback that was really important for the results of this. And I echo a lot of what Tracy Drake had said, and agreeing with the results of this and how I think it will streamline the process for everybody. And I did want to say I appreciate your question about language too, because since COVID started and we restarted testing, I've been tracking languages, and we do offer testing in 13 different languages. So there is a lot of people that are taking the exams in different languages, Ukraine and Somali and Vietnamese. And so that's a concern. But I do think the immigrant question was a good one to find out whether or not that's impacting our workforce numbers. But getting back to this, I think the changes that were submitted by the auditors are really going to be beneficial. And I wholeheartedly, representing DSHS, agree that it would be a good change to make to integrate. So we've been working diligently with DOH. They're an excellent partner, and we meet with them weekly for the last 4 years. So we've got a really strong partnership in making home care aides, because we're in charge of the training and spec, and they're in charge of the testing and certification. So combining those, I think, has been a challenge, but we're working on it every day and every week. And I think we're going to get there and get people into the workforce and serving all the clients that we need to serve. So thank you, everybody, for this Herculean effort. It's a lot.
Well, there's only one question I have for the two agencies, which is, are you anticipating that you'll have a collaborative decision package, budget, and legislative statutory request to implement the recommendations?
We sure hope so.
Okay.
Yes.
I encourage you to reach out early to all the relevant committee chairs because, as I said earlier, it crosses several jurisdictions. Representative Orcutt.
Yeah, I just want to be clear, that's committee chairs and ranking members.
Yes, indeed. I just want to say, for example, that the post-secondary and workforce development committee is often forgotten, but we hear the certification testing, not the health committee. So with that, is there any, I'm not seeing any other questions, but thank you for the continued collaboration and efforts to improve the program, and look forward to helping make those improvements in the coming session. Thank you.
Thank you.
Again, do we have any public testimony? Anyone signed up? No, we don't. Anyone in the room who would like to testify? Not seeing anyone in the room wishing to testify. Anyone who does wish to provide written testimony on today's report or any other topic today can submit comments to jlarc@leg.wa.gov and by mail, P.O. Box 40910, Olympia, Washington 98504. And all written testimony is distributed to the membership of the committee. Not having any other business before us today, you are now all free to enjoy a 90-degree sunny day in Olympia. And the meeting is adjourned. Thank you.
Thank you.